IVM.
Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hi, I'm Sarthak and I welcome you to one more episode of All Things Policy. In the last few weeks, the 5th National Family Health Survey report was released. In this episode, we are going to discuss some of the interesting findings of the 5th round of National Family Health Survey and also some of the policy implications of the same. For this episode, I am joined by my colleague Suman. Hi Suman, welcome to All Things Policy.
Hi, Sarthak. Welcome. Pleasure.
Yeah, welcome once again. Yeah. So before we discuss or before we go into the findings, I just want to talk about what is this National Family Health Survey and how this is relevant. Few weeks back, Pradhan and I were discussing the data related to poverty. Right. And at that point of time, we realized or we discussed that there are different ways by which poverty can be estimated. And one is usually the monetary method. Right. The other is the method by which you get to know about different kind of deprivations people have. And according to the deprivations, how you can tailor your policies. Right. And at that point of time, we talked about the multidimensional poverty index and how the multidimensional poverty index takes data from National Family Health Survey, which was conducted in 2015-16. That was the 4th round, right? So at that point of time also, we mentioned some of these things. So this National Family Health Survey, what it does is it collects data, demographic data, health data, nutritional data, socioeconomic status data, and on the basis of that, you get an idea where people lag behind. Right, whether they are having sufficient kind of nutrition, whether their health status is optimal, whether they have access to insurance, health insurance, all these kind of data you get from the National Family Health Survey. On top of that, this is kind of one of the largest kind of surveys in India. Right, the NFHS5, which covers the duration of 2009 to 2021. It surveyed around 6.4 lakh households. It is much larger than the national sample surveys or any other national survey. So since the sample size is also large, we can say that, okay, it kind of has a very correct depiction or it has a legitimate depiction of how people live their lives in India. So Suman, you have also gone through some of the findings. Is there anything interesting that you came across?
Yeah, lots of interesting data points, some of which we already knew, some of it we wanted to be corroborated by some exact numbers or something like that. But by and large, it seems to be, it's throwing light on the situation as is. The first most important or interesting thing I found was about the population trends or total fertility rate. Now, this topic has been, it sparks a lot of interest. It sparks a lot of controversy in a lot of places. Therefore, this number is watched very closely. Okay, from the 60s, from the early years of the Republic, population explosion was always, meted out to be like such a big problem. We have to get it under control. And we were okay with, some people were also okay with coercion as a method to bring the fertility rate under control. But what we have seen through the years is that without coercion too, but with other policies in place, we can bring this total fertility rate lower. What we've seen, the most interesting part of this here is that, again, the total fertility rate is reducing. So the total fertility rate refers to the replacement, number of births versus number of deaths, the replacement rate as such. It has reduced from 2.2 to 2.0. Again, there are regional variations. There is an urban versus rural difference, etc. So the urban is well below the replacement rate, which means that there are other policy implications for us. The urban total fertility rate is 1.6 versus the rural, which is 2.1. Right? Again, regional variations are there. States like Bihar, Meghalaya, Uttar Pradesh, Jharkhand, and Manipur are states that have a fertility rate which is above the 2.1 replacement level of fertility rate, which is considered the replacement of fertility. So these 5 states still have some distance to go in bringing the fertility rate down to the replacement level, whereas there are other states which have achieved this in good time. Yeah. So policy implications as such is that if the replacement rate falls below, if the fertility rate falls below the replacement rate, which means you will have an aging population. So, we have to design policies to take care of this, which means healthcare, old age living, and any of those kind of policies need to come to the forefront as quickly as possible. What we have also seen is why has the TFR reduced? What are possible reasons why and what can we do better? It's very clear that with increase in education and access to healthcare services, contraception, etc., the TFR is falling. Okay, so as women are gaining more education, with every year of schooling that women get, the fertility rate actually falls down. Okay, so the importance of education can never be overstated here. So we have to focus on women's education, on education overall, specifically in women's education. And so our policies need to be, geared towards those kind of, factors or those kind of areas. The one worrying thing that I have seen or I noticed in this is that teenage childbearing age or teenage childbearing has not, we have not made much progress. It was 8%, it was 8% in 2015-16 NFHS. It is now reduced by just 1% to 7%. So this is a little worry. And I think we need to focus a little bit more on that part of the population trend as such.
Yeah. So, Suman, I just want to go back to some of the things that you mentioned, the policy implications. Now, as you mentioned that the fertility rates have declined. Many of the regions in India, many of the states in India, urban areas, there the fertility rate is below the replacement rates, right? And so to some extent, it highlights that maybe when it comes to population, we are moving in the right direction. But thing is, many states and many political parties sometimes talk about different kind of coercive methods even now, right? So this thing might not make sense because, as you mentioned, access to education, access to health services, these have been the primary factors which have reduced the fertility rate. So maybe the focus should be on this rather than the different kinds of coercive mechanisms which are suggested time and again.
Yes, definitely.
Yeah. Apart from that, as you mentioned, that there are certain states like Bihar, Uttar Pradesh, right? These are states where the fertility rates are still high. And these also happen to be the states which have large population, right? So fertility rate is high and population is large, while in other places, the fertility rates are going down. There will be aging of population, right? So this kind of gives you an idea how the labor or the movement of labor is going to happen in future. Migration, yeah. So migration policies, by the way, there are different barriers to internal migration as well. Though the constitution says that everyone can move from one place to another, but there are different kinds of barriers to migration at the present. And in India, most of the migration is for very shorter distances, right? Mostly it is rural to rural migration. Mostly it will be within the districts or within the states, right? But as you can see, some of the states which have large population, they also have very high fertility rates. In future, we might have to design our migration policies. The states have to design the migration policies, or at least they have to be open to migrants because they might have shortage of labor, and then there are some other states which might have excess labor.
Yes, while it is a political flashpoint, maybe I think the demand supply will point to a certain direction, and we should let that flow go through peacefully. But it is always a contentious topic.
Yeah. So I was looking, apart from this contentious topic, I was also looking at the health and nutrition data. And this is something which was kind of interesting, but it's something which is not on the expected lines. So what the data points out is 89% of children in the formative ages, 6 to 23 months in India, they do not receive a minimum acceptable diet. So large number of children, a huge proportion of children are not getting the right kind of diet. And here, two states, the states of UP and Gujarat, they have the highest proportion of children not getting minimum acceptable diet. So this was kind of surprising to me. One is the number, and again the states, right? Two states which are kind of different from one another, right? Gujarat, whose GDP per capita is kind of high, UP might not be, but both of them have like the highest proportion of children not getting minimum acceptable diet. Apart from this,
Gujarat stands out as because it's always considered amongst the more developed states. So this comes as a surprise.
Yes. On top of that, if you look at the data for stunting as well as
wasting,
right, underweight children, that has increased, right? So as per the NFHS4 data, 19.7% of children were below the age of 5 were stunted. As per the NFHS5 data, it is 23.4%. Similarly, when it comes to underweight children, the percentage has increased from 16.1% to 19.1%. Right? So these are things which should not have happened, or I don't know what is the reason why this is happening. And what is also interesting is there is large proportion of children who are wasted stunted, and at the same time you also have obesity rates increasing, right? So the obesity rates between the two surveys, right, it has also increased both among men and women.
Yeah, that is kind of a paradox, right?
Yeah, exactly. So given these kind of things, right, health and nutrition, a large part of these things will be dependent on the state governments, how they're delivering different kind of services. So the policies should be such that, I mean, the state capacity should be more. The states have a better understanding of these problems, maybe. So solutions might be at the local levels, but at the union level also, there should be some acceptable baseline or some form of benchmark. And according to that, the different states can be possibly given incentives, right? Okay, if you're able to reach this particular benchmark, we should do this. Or to reach this particular benchmark, the union can provide some support to the states.
True. I think, and also each state should come up with their policies, keeping in mind, cropping patterns, their diversity in what is found in each place, etc. Right? So that plays an important role in nutrition, especially, and also helps to bring down obesity.
Yeah. So before we go to the next part, let's have a small break.
Hey, it's been another great week on the IVM Podcasts Network. On the Filter Coffee podcast, Karthik talks to Svetlana Nodial, Programming Director Asia Movie, about how movie curates access to world cinema. Introducing our new show, Capgemini's Techipedia series with Sheeladitya M. In the first episode, we meet Nishit Srivastav, Chief Technology and Innovation Officer at Capgemini India. He tells us all about the metaverse's impact on different domains. On Paisa Vaisa, Anupam explores stock market trends with Prabhakar Tiwari, Chief Growth Officer at Angel One. On All Things Policy, the Takshashila folk discuss how the latest events in Sri Lanka impact India. On The Habit Coach, Ashton shares 3 steps to shake off a slump. And on Say No to Drama, Chetna explains how we can protect ourselves from energy suckers. We've got some exciting news for you. IVM Podcasts has just launched its merch, and our first line is out now. Head to the IVM Podcasts website and click on the Shop tab to check out our first collection of t-shirts. Do follow us on social media. We are IVM Podcasts on Twitter, Facebook, Instagram, and LinkedIn. And remember, if you're enjoying this show or any of our other shows for that matter, please do tell a friend. Don't forget to rate us on any platforms you're listening on. You can also check us out on YouTube. We are also doing a small listener survey to better understand how you respond to our shows and advertising on the network. We would really appreciate if you could spare a few minutes to fill it. It helps us build better shows for you. And finally, we would like to thank our sponsors this week, SBI Life Insurance and Jupiter, a digital banking app.
Yeah, so we are back. So, Suman, what are some of the findings when it comes to gender?
Yeah, gender is an important topic, to find the right balance for everything else. So looking at the NFHS data, there are some, of course, there is something to cheer about, but there are some data points that throw some questions with respect to the data itself. Okay. So firstly, the sex ratio shows that there are 1,020 females for every 1,000 males in the country. Now, this ratio was 991 to 1,000 in NFHS 4 and 1,000 in NFHS 3. Now, the NFHS is one way of collecting data. The census collects data in a different way. Now, the census has recorded country's sex ratio as 940. Now, 940 to 1,020, that's a big number. So, clearly the census is underreporting, or,
NFHS is also overestimating. That might also be the...
Yeah, maybe. Different reasons why, because NFHS is just a survey and the sampling could involve only families, etc. So, it would be different maybe in when you do a census versus when you do this survey. Okay. So that is one data point that we need to keep in mind. But overall, if we have to take one message out, I think it is that the sex ratio is improving, but it doesn't mean that we stop doing, whatever we are doing to improve the sex ratio. I think there has to be concerted effort still, because gender parity is still far, we are a huge distance away from. Another data point that, instead of looking just at the sex ratio, if you look at the sex ratio at birth, which refers to the number of boys born alive per 100 girls born alive. That is, in the sex ratio of birth at the fifth NFHS, it also takes into consideration children who die before before they attain the age of 6. So, which means that this is a more representative or more realistic number. Now, according to this, the SRB, or the sex ratio at birth, has gone up from 919 in 2015-16 to 929 in 2019-20. Okay, now, this is a good improvement. Again, you will see that there is a significant rise in this in the rural areas, whereas in the towns and cities, it has been very marginal. Okay. Now, in towns and cities, why should the sex ratio not be better? It points to, a probable attribution to, because there is an availability of sex determination methods, greater availability in towns and cities, there are more female or feticide or infanticide that happens. So this is something that needs to be investigated. We can't point out for sure, but I think we need to take this with a slight pinch of salt. But the overall message seems to be that we are getting closer to the desired ratio as such. The other part of, there are few other, qualitative feedback or pointers that come. A large number of, you would think that with increase in education, with communication and, exposure, etc., you would think that tolerance to domestic violence, tolerance to inequities will be much lower now. But what this survey shows is that a large number of Indians, including people in states like Tamil Nadu, which are generally considered progressive, are very tolerant towards, physical violence against women. They think it's permissible. They think it's okay. Nearly a third of women between 18 and 49 have experienced physical violence, and only 14% of those experiencing this kind of sexual physical violence actually reported to the authorities. So our statistics on violence itself may be undercounted and under. It is also, we also read, we've also seen elsewhere, in the light of, criminalizing, or in the light of the marital rape judgment, etc., where violence within the institution of marriage is somewhat okay. But what we see from data is that majority of violence happens within families by the husband to the wife. So when it is such an important, or when it's such a stark finding of this thing, I'm really surprised that the marital rape judgment came out the way it did. Yeah, that is a very sobering, very disturbing trend as such from this.
Yeah, Suman. And apart from these dynamics, right, the survey also talks about access to different kinds of services. Right, for example, access to water facilities, access to drinking water facilities, sanitation facilities. So here also we find some interesting trend and some trends which are actually diverging from some of the previous studies. For example, when it comes to sanitation, right, in 2019, India had declared that all villages, gram panchayats, district, states, union territories in India, they had declared that they have become open defecation free. Right, I'm talking about 2019. But if you look at the NFHS data, it's slightly different. According to this NFHS5 data, 19% of households in India do not have any toilet facilities. And in the past, there have been some other surveys as well. The National Sample Survey, then you have a National Annual Rural Sanitation Survey, right? According to the National Annual Rural Sanitation Survey, open defecation free status of India is, they're saying that 93.3% of households in India have access to toilets. So again, we're moving in the direction of being open defecation free. But if you look at the NSSO data, it is less than that, right? According to NSSO, it is 71.3% households, right? So whatever claims have been made in the past, and if you look at the NFHS data, there is massive amount of divergence, and definitely we are not open defecation free. And same thing applies when it comes to access to drinking water facility. And here one thing I want to point out, they have talked about, they have used certain terms here. access to improved drinking water resource, access to improved sanitation facility. And they're saying that 99% of urban households have access to improved drinking water source. 95% of households have access to improved drinking water source. Now, what exactly
How do you define it?
How do you define it? What all comes under it? That is important, right? So again, maybe the numbers look good, but if you dive deeper into it, maybe there will be the interpretation will change, right? So this is something that I came across when it comes to water and sanitation.
Yes, Sarthak, a lot of interesting data has come out, and we are poring over it. This data. What are the policy implications according to you about this?
Yeah. So if I look at it at a macro level, right now, first thing is from this data set, right, we get an idea what are the different kind of deprivations, and we get this idea at the state level, at the district level, right, and of course at the union level as well, right? So if you understand the deprivations, accordingly you can have policy measures, right? So the NFHS5 data is helping. The first thing it is doing is it is helping us understand these deprivations. Now, another thing is, if you look at the historical data, NFHS4 or some other data set, and compare with NFHS5, so from that we might get an idea about where things stand, right? Whether there is an improvement or whether things have become worse. If there is an improvement, now the second thing that we can possibly do is we can zero in, right? Why there is an improvement. And again, if things are going well, then again, do it. But if things are not going well, right, in that case, we need to identify what is the reason why things have become worse, right? For example, we are talking about stunting, we are talking about wasting of children, right? The numbers have become worse over a period of time. So again, we have to zero in, we have to identify what is the reason, right? Is it because people do not have sufficient amount of resources? Is it because people have lost jobs, or their wages have gone down, their financial situation has become worse, their consumption, and as a result of which their consumption is decreasing? Is it because of some form of social norms? Because there is, again, a regional variation here. So again, the public policy has to be based on these kind of things. We have to be specific, right? We need to find out what is the reason for it. The next thing is we need to have more data sets. We need to have frequent data sets so that we can continuously track where things are. And we need to have more data sets, because if you have more data sets, you can now, if there is a flaw with one data set, you can identify that with the help of the other data sets. So there should be more data, more ways by which data is collected, and maybe we should have more conversations around the same, right? And that will help us identify if there is any methodological error. Just like we saw when it comes to sanitation, right? There are different data points. When it comes to sex ratio, again, different data points are there. So maybe some of these things can be rectified. Another thing is, how do we define some of these things, right? It has to be clear, right? For example, what is improved water source? What is improved sanitation facilities and other things? So again, clarifications about some of these definitions needs to be focused on, right? Or else we might be just painting a rosy picture and things in reality might be completely different. Another thing, see, many of the things that we discussed, right? For example, health, sanitation, hygiene, different kinds of services that we are talking about. A large role has to be played by the state governments and by the local governments over here in providing these services. So we also need to identify whether the states, local governments have enough resources, capacity for all these things, for providing all these things. And because they are at the hem. So the policy should be such that the state's capacity is augmented. Let's say their public finance situation, right? They should have enough resources at their disposal, and they can decide how they can spend on some of these things. That said, we can also possibly identify some benchmarks at the union level. Some basic baseline or benchmark can be there that, okay, all states should have at least this minimum.
Something that everybody should aspire.
Should aspire to have, right? So at the union level, some of these baselines can be there. And again, the different kind of resources that the union is transferring to the states, maybe it can be on some of those grounds. So I think these are some of the points that we can include, or these are some of the points that should be taken into consideration.
That was interesting, Sarthak. Thank you. I learned a lot.
Thanks, Suman. Thanks to the audience for tuning in. We'll meet again in one more episode of All Things Policy.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, If you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle at TakshashilaINST or our website takshashila.org.in.
Are you looking for finance products and services that can enhance your personal finance experience? Are you looking for a space to talk about your financial product or service? And are you looking for a crisp talk show where the conversation is all about money? Well, your search ends here. Hi, my name is Anupam Gupta and I'm host of the Paisa Paisa podcast, and I invite you for the conversation about your personal finance on each Monday on the IVM Podcast app or the website or on any podcast streaming platforms. See you folks.
There's a quick survey to fill out on ivmpodcast.com/survey. It lets us know a little bit more about who's listening to us. And you know what? We're going to do a few prizes. So, we'll do a random drawing of maybe 10 people and we'll send you all some swag. Remember, that's ivmpodcast.com/survey where you can fill out the survey.